There has been a recent discussion in the media about the relationship of nitrate ingested from drinking water and several cancers. Today I want to discuss this relationship, help you understand the actual risk, and how to avoid nitrates in your drinking water. Nitrate is found in many foods, with the highest concentrations in leafy green vegetables and root vegetables. In the body, nitrate is converted to N-nitroso compounds, many of which are carcinogens, meaning they can cause cancer. Because the formation of N-nitroso compounds is inhibited by vitamin C, polyphenols, and other protective compounds present in high levels in most vegetables, dietary nitrate intake does not appear to result in significant N-nitroso compound formation. Nitrate levels in our water systems have increased largely due to applications of inorganic fertilizers and animal manure in agricultural areas. Since approximately half of all applied nitrogen drains from the agricultural fields to contaminate surface water and groundwater, concentrations of nitrate in our water systems have also increased. And this trend of increasing contamination in our water supply by nitrate is expected to continue. The maximum contaminant level for nitrate in public drinking water in the United States is set at 10 milligrams per liter, which equates to 10 parts per million. The maximum contaminant level was set to protect against infant methemoglobinemia. This is a condition where an infant turns blue because of too many nitrate compounds in water. However, other health effects, including cancer, were not considered in setting this level. Increased nitrate in water supplies has been linked to colon, ovarian, thyroid, kidney, and bladder cancers, with the strongest association with colon cancer, resulted in an estimated 6,500 cases of nitrate-attributable cancers per year. In most studies, the increased risk of cancers was associated with nitrate levels well below the maximum contaminant level of 10 parts per million. In fact, a study from Denmark reported a statistically significant increase in colon cancer with nitrate in drinking water at levels of 0.7 to 2 parts per million. This was particularly true for men with high red meat intake. A study from Iowa observed an increased risk of colon cancer from drinking water nitrate levels above 5 parts per million for individuals with above median red meat consumption and low vitamin C intake. Based on current data, the level of nitrate in Des Moines water from the Fluor plant is 8 parts per million, and that of West Des Moines water is 0.6 parts per million. The state average, based on a 2015 analysis from the Environmental Working Group, was 0.995 parts per million, with a national average of 1.01 parts per million. The health guideline, defined as 1 in a million cancer risk, is 0.14 parts per million. Despite the fact that Des Moines water complies with federal standards, meaning nitrate levels less than 10 parts per million, the amount of nitrate in the drinking water is 8 times that of the national average and would appear to pose a small increased risk of colon cancer in susceptible individuals when consumed over years. The best way to protect yourself from drinking water nitrate-associated risk of cancer is to drink filtered water. Bottled water may not be the answer, since the bottled water industry is not required to disclose the results of any contaminant testing that is done. The best way to know if your drinking water is free from contaminants is to contact the bottler and ask for the latest testing results. Neither the EPA nor the FDA certifies bottled water. The best way to learn more about your tap water supply is to read your water supplier's annual water quality report, which can be found online. Nitrate can be removed by reverse osmosis filters, but not by carbon filters. Also, to minimize the formation of N-nitroso compounds, eat a diet high in fresh fruits and vegetables and minimize the consumption of red meats, particularly those that are charred on a grill. An important point to remember is that there are many other lifestyle factors that can reduce your overall risk of cancer, and that reducing drinking water nitrate exposure is only a small part of a cancer risk reduction strategy. In order to fully leverage lifestyle changes for cancer risk reduction, I advocate the following. Maintain a normal body weight and eat a mainly plant-based diet, avoiding processed and fast foods. Learn to manage stress through breathing exercises or meditation. Get 7 to 9 hours of quality sleep every night. Exercise daily for at least 30 minutes. Get outside every day and enjoy nature. Be compassionate to yourself and love yourself. Enjoy energetic and nurturing social relationships. Cultivate a spiritual practice. Limit alcohol consumption. And if you use tobacco products, quit.